Alright, we're live. The Facebook, okay. We're live on all the platforms. You can introduce yourself.
Hi, good afternoon, everyone. Welcome to Alvernia Hospital Ask Your Expert live session. This is the first time we run this session, and we thank you for all your support. Please allow me to introduce myself for a minute. My name is Fonnie. I am a lactation consultant, IBCLC since 2004, and I am a registered nurse and registered midwife. So I'm the HOD at Parentcraft Center at Alvernia Hospital. So we have a team of 10 of us. So we are here to guide new parents on how to manage their breastfeeding and baby care. Okay, so we are on live across IG, Facebook, and TikTok. So a warm welcome to wherever you are from. Please feel free to post your question in the chat, and I will try my best to answer all your questions. And I also thank you to our team behind the scene, M&M, okay, to keep posting, updating me of the questions that you are asking, and as we go. So now we are giving a few moments for everyone to join in. Please let me know whether you are first time daddy mommy, or where you are pregnant, and how far is your pregnancy, or any grandparents here. And how are you today? How's your mood today? Sunny or gloomy? Yeah. So please feel free to ask your questions. Yeah. Thanks everyone for joining again. Yeah. So while we are waiting for some questions from the audience, I would like to share a little bit of the common question that parents might be worried when their baby is born. A lot of times, what happens is, mommy and daddy will say, "Oh, I don't think I have breast milk." So what happens is, when we are pregnant, our body, the hormone is getting us ready for the colostrum to come in as early as 16 weeks of pregnancy. By the time baby is born, the milk production depends on demand and supply. How much I feed the baby, how much I clear, how much I get it back. The more I clear, the more I get. Oh, thank you, Sue. Yeah. So, Sue is asking, okay, how often to breastfeed my newborn? Thank you for the question. So, babies, actually, the stomach is very small when they are newborn. So we need to breastfeed our baby every 2 to 3 hours. So baby will show you the hunger cue. And whenever baby show hunger cue, we just breastfeed the baby. Now, please remember, first 2 weeks, baby, the liver is not mature yet. Okay? And they will start jaundice by day 3, day 4, day 5. Now, once the baby started jaundice, what happens? They're very sleepy. And if we think I let the baby sleep, what happens? They will go drink lesser and lesser, the jaundice will go higher and higher. And that's why first 2 weeks important. When my baby sleep too well, I need to wake my baby up every 3 hours, round the clock. Okay? Yeah, is there any question? Let me see. Oh, sorry, I'm not talking loud enough, is it? Oh, okay, yeah. Is it here now? The voice louder already? Thank you, yeah, for joining, and feel free to ask any questions. Yeah. Okay, so while we are waiting for some of you still coming in, yeah, so we welcome those just joined. So I introduce myself again. I'm Fonnie. I'm the head of Department of Parentcraft at Alvernia Hospital. All right. So the next questions, parents, they are worried is, how do I know my baby get enough milk? So if I do full latching, full breastfeeding, very important, I need to monitor my baby urine and motion, the output. So only if they drink enough, they have enough output. So when you are coming in to deliver or when you attend our childbirth education course, from there we will give you all the information. How do I know my baby is doing enough? How many times of urine and motion that we are expecting my baby to pass per day? Okay. And okay, thank you. Israel, yeah, there's a question. If the baby has a lack of sleep but has reached the 3 hours mark for feeding, should I wake her up or let her sleep? It's a very good question. If my baby is still a newborn within the first month, I would say I would like to wake my baby up because I need to ensure my baby drink enough. But if my baby is already after 1 month and above, and a lot of baby during that time, when they're hungry, they will tell you. So you don't need to be worried. All right? Yeah. So another question is from Asaki. Yeah. How can I tell my baby is hungry? Thank you. This is a lot of parents, they will ask this question. Sometimes they think baby crying is hungry. Actually, it's not true. So baby will show you the hunger cue. So when a baby is sleeping, okay, they will close their eyes, then suddenly you see them, the mouth is like chewing something. This is a early cue. That means in their little dream, what are they doing? They're chewing a drumstick. You need to prepare yourself, all right? And when they are, some of the baby, they will move the hand, then try to suck the fingers, or when your finger touch the little lip, then they will open the mouth and follow your direction. You know they are hungry. This is the hunger cue. So a lot of times when we wait till baby is crying, that is the late cue. Once baby start the late cue, what happens? When you latch, some baby they will get angry, they will bite on you first. All right? Some baby cry too tired already, and they just fall asleep when you start latching. Yeah. So all right. So while we are waiting for some questions, yeah. Sorry, the screen is up. Yeah, the screen is up. Yes. Thank you. Okay, so is there any, we welcome those new join in. Yeah, I believe that there are a few of you just came in. So let me introduce again for myself again. My name is Fonnie. I'm the HOD at the Parentcraft Center at Alvernia Hospital. So I'm a lactation consultant since 2004. Yeah. Thank you for the question. Okay, question. I'm breastfeeding. How do I know if baby is getting enough milk? Oh, thank you, Kaishan. Most of the parents are worried about this point. So as earlier on what we mentioned, very important, monitor your baby output, urine and motion. Now by day 4 onwards, all the babies should pass minimum 6 urine and 4 motion per day. How often do I change the diaper? Okay, I will check the baby diaper before I feed. After that, after feeding, I will check. If dirty, I change again. I mark down, all right? During breastfeeding, a lot of baby, they will pass urine motion. Don't change. Otherwise, what happens? Whole day, you are changing diaper, breastfeed the baby, changing diaper. It will be very busy. Just make it as before and after feed. And check and change, yeah. Okay, so there's another question from Miss Go, yeah. So my flow is very fast and baby often chokes when latching. May I know what I can do in this case? Oh, congrats that you have fast milk flow, okay? But at the same time also we need to learn a little bit of the management. So a lot of time when baby get choked because of the fast milk letdown or mommy oversupply, what we can do is we use different position to breastfeed the baby. Like, okay, baby, come. So here's my baby. So maybe I can consider lay back, because lay back is a good position for some baby when mommy is having a fast letdown, baby can manage well. Or mommy can do side lying. And some mothers, by doing position changing, still cannot. So maybe you can sit the baby upright, support your baby well. This is a good position, easier for the baby to latch and swallow and manage your fast like that. So by doing positioning, if you find it's still very challenging for you to manage, maybe you can consider to call our clinic. You come in, do a session, we do a full assessment and guide you step by step how to manage this one. Okay? Yeah. So, thank you, May. Another question from May. My baby keeps crying even though she is being carried. What can I do to calm my baby? Okay, crying baby. I always tell parents, when baby cries, take it as what? Communication. Your baby is telling you something that they want to convey the message to you. Now, I'm not sure how old is the baby. So first, when a baby cries, what you can do, whether baby is hungry, you check. Okay, if baby is not hungry, maybe you finish feeding not long and baby keep crying, maybe baby, what? Maybe the baby has some gas, you need to burp. Or after you burp, baby still crying, maybe you check the diaper because some babies, okay, they like the clean diapers. After you change, they feel better. If by doing all these 3 steps, they are still crying, the next step I would say, maybe your baby needs to be carried for a while. And once you carry the baby settle. I don't suggest you keep carrying the baby till they are fall asleep. So when the baby is a bit drowsy, I will say, okay, I swaddle my baby. I will gently tap my baby. When I tap my baby, yeah, I will tap the baby till they are drowsy and I don't tap anymore. Then I will put my hand there, let the baby know I'm still here. So some baby, when they feel that you're here, they are okay. Yeah. And some babies, actually, they need your attention. You talk to them, you play with them, settle them. And some baby, due to particular reason, maybe they are very cliquey, that's why need you to carry all the way before they can settle. If that is the case, please talk to your pediatrician. Let them know. They will help you to check whether baby is too gassy. They will give you some maybe probiotic or gas medicine, and they will help you in this way. So if mommy is doing breastfeeding, sometimes maybe baby is a little bit sensitive to certain type of food that we are eating. So you can welcome to call us. Okay, so we will help you to screen to all these questions. Yeah. Okay. Okay. Sorry, I can't spell the name. Never mind. So there's one mommy asked, okay, if I choose to express breast milk for 9 feeds, will that affect milk supply? Thank you for this question. Actually, recently a lot of mommy are asking this question because they say they are too tired after they deliver. During the daytime, they do all breastfeeding, and nighttime, they would like to express the milk, let caregiver to feed their baby by either syringe feed or cup feeding. So it's fine if you are really too tired. Do not stress yourself, relax, and follow your heart, follow what you are doing. So it won't affect the milk supply. You still will have the enough milk supply as long as you breastfeed the baby or you express the milk regularly. Okay? So another question seen coming. Okay, my baby is 20 days old and I am experiencing low milk supply. While it is improving, how can I determine where to stop trying to increase supply? Feeding from both breast and formula, how can I tell if they are experiencing nipple confusion? Thank you, C. This is a very challenging situation. Now, low milk supply first. So, 20 days old baby, no milk supply. So, I would suggest mommy need to take some maybe supplement to boost your milk supply. And at the same time, make sure baby latch properly, because there are some baby, they don't do a deep latch, or when they are on the breast, they are very sleepy. They cannot help mommy to stimulate milk flow. If that is the case, we will suggest after your breastfeeding, just get a pump, use the massage mode to stimulate your milk. All right? And how can I determine when to stop trying to increase the supply? I did have a mommy, okay, baby about 4 to 6 weeks old came and see me, very low milk supply. So we tried all the way, almost till 2.5 months old baby, she can manage her full breastfeeding. So I will never say too late to stimulate. All right, just do our best. And okay, the next question is, okay, feeding from both breast and formula. Okay, I would suggest that if your baby take from both breasts, can settle about 1 hour to 2 hours. That means you try to full breastfeeding, because the more your baby drink up, the more milk you have. But if you found that still difficult for you to manage, please do consider call our clinic, come in for our consultation session, so that we can help you to check, okay, how's the baby latch, how well your baby start, how to use the pump to stimulate your milk, and we will give you a very comprehensive planning for you to manage at home. All right? Yeah. Okay. Thank you for the reminding, M&M. Okay. So we have a new joiners here. So please let me introduce myself once again. My name is Fonnie. I'm a lactation consultant, a registered nurse, and a registered midwife. So I'm the HOD, head of department of Parentcraft Center at Alvernia Hospital. Yeah. Okay, Ty has another question. How do I tell if my baby is full? All right, your baby will tell you actually. I always tell new parents, observe your baby behavior. From your baby behavior, you can tell. Babies, when they are full, they will either fall asleep or drowsy, okay, and you try to touch their mouth, they don't want to open mouth, they don't follow your direction. And your baby look calm, they will look contented. Yeah. So, but very important, whether they drink enough, monitor urine motion. Okay? Now, Miss Lee, yeah, Serenian. Yeah, there is another question from Miss Lee. My baby is 9 months old, but still cannot sleep through the night. What should I do? 9 months old, actually, I'm not sure whether your baby, before this period, whether there was time baby can sleep well. Because there are babies that they have what we call sleep regression. That means they can sleep well a certain period, but when they are 4 to 5 months old, or 6 to 7 months old, or 9 months old, they have a sleep regression. This is one of the milestones that for baby normal development. During this period, they learn a lot of new things, and their little brain at nighttime, the brain activity is still very active. That's why they refuse to sleep. So if, okay, your 9 months old still cannot sleep well, first, please check with your pediatrician to see, let them check your baby, is there anything that will help them, or you're welcome to call our clinic. Then through the phone, you let us know how's the baby in the past, the sleeping pattern. From then, we try to explain to you how to help you. All right? Okay. Agnes, thank you for the meeting. Thank you for the question. Why can't newborn have water? And when can we feed them water? Very good question. In the past, a lot of parents, they will feed the baby water. Yeah. Nowadays, we know that from the breast milk, 87% of the content is water. And even though infant formula, now the water content is all enough for a baby for the water intake. So baby, the stomach is very small. If I feed the baby with water, when they drink milk, they don't drink enough, it will affect their nutrient intake. All right, we want the baby to drink enough milk to grow well. Okay, Chill, another question from Chill. I noticed that my newborn baby boy appears to have one testicle that is larger than the other side, but doesn't seem to be any pain or discomfort. should I bring him to do any further tests? I say, oh yes, please bring your baby to see your pediatrician. Let them help you to find out what's happening and what is the next step to do. Okay? Okay, thank you for the reminding. Yeah, we have a new joiner again. So I'm Fonnie. Yeah, welcome to our live chat. And I'm a lactation consultant, registered nurse, and a registered midwife. And I'm the head of department at Alvernia Hospital. Yeah. So okay, we have another 10 minutes left. So please feel free to put in your question in the chat. So let us try to answer your question as many as possible. All right. Okay, Rochelle is asking. Thank you, Rochelle, for the question. My 2-week-old baby only feeds around 5 to 10 minutes, then fall asleep around 2 hours. Is it all right? Okay, Rochelle. First, are you doing full breastfeeding? If yes, please check. Okay, after baby latch, do you feel the breast is lighter, softer, and monitor baby urine motion? If baby urine and motion is okay, and body weight is increasing according to what we expect, that means your baby is drinking enough. Maybe you have all the milk enough to supply to your baby. So if you are worried, you can consider come in, book an appointment to see us. We will do a consultation and help you to check the baby milk intake. By then, easier for you to gauge out. All right? Okay, yeah. Okay, there's a question from Happy Alvernia Day. Okay, my baby is about 7.5 months old and have been drinking express breast milk since birth. I have recently introduced her to infant formula, but she has rejecting. What can I do during the transitional period? Okay, it's a very good question. And first, if you have enough express milk, I would say, please continue your breast milk. Your breast milk is still the best for your baby. Second, only if those mommy, they found that, oh, they might not have enough breast milk storage to supply in a few weeks' time, that is the time that I would say we have no choice. Baby reject your infant formula. So you can consider mix a bit of breast milk, maybe 3/4 of breast milk, 1/4 of infant formula, mix a little bit first, 30 to 60 ml, let the baby taste it slowly, let the baby taste the infant formula. And by the way, your baby 7.5 months old should have started complementary feeds, correct? So if baby already started complementary feeds, the milk intake, they don't really drink as much as before 6 months old. So maybe if you're worried, yeah, you can check with the pediatrician whether your baby is eating enough, okay, or check with our, I think pediatrician will tell you. Okay, Ken? Yeah, I have answered your question. Now, another question from Bubuyans. Yeah. Sorry if I pronounce your name wrongly. Yeah. Is it normal to feel pain during or after breastfeeding? The pain, I'm not sure from where. From the breast? By right, if baby do a deep latch or push up position well, mommy should not feel pain on the lip roll or areola on the breast. Okay, so I'm not sure where is your pain. Please help me to type in the chat where is your pain, from the breast or from the womb or from where. Thank you. Yeah. Okay, Kikua. Yeah, so there's another question from Kikua. Okay, as I just joined, not sure if this question has been asked. Don't worry. Yeah. So my question is, if I'm sick, I'm down with bad flu, can I continue breastfeeding? Will my baby catch the flu through breastfeeding? Very good question actually. Last week I had mommy call in and because she felt sick, whether she should continue breastfeeding. My advice is please continue your breastfeeding because when you are not well, your body will produce antibody And through the breast milk, you protect your baby. But very important, if you have bad flu, hand wash before you handle baby, and at the same time, wear mask when you handle your baby. All right? When you cough, when you sneeze, don't directly face the baby. Change your mask regularly. So it should you please continue your breastfeeding. Okay, sorry. Yeah, my voice is too soft. I'm sorry. Yeah. Okay, now better. Okay, how do I know if that I am producing colostrum? And how should I collect it? Yeah, from TikTok or Satoru, is it? Yeah, okay. Thank you for the question. Basically, I believe that you ever heard antenatal colostrum harvesting. So we can collect our breast milk, our colostrum from 37 weeks of pregnancy, because whenever we collect before 37 weeks of pregnancy, sometimes it will introduce premature labor. And also your pregnancy must be uneventful, okay, no complication, and good to check with your gynae doctor whether you can collect your colostrum antenatally. So how do I know if that I am producing colostrum? And earlier on, we mentioned before, when we are pregnant because of the hormone effect, majority of the mother by the 16 weeks of pregnancy, they start to produce colostrum. But whether you can collect, it depends on the skill of your hand expression. So we do have mummies, because they want to learn how to do the hand expression of the colostrum. They book appointment with us, they come into the clinic and learn how to do this part. So you're welcome to call us, yeah, and book appointment. Alright, so time is running fast, so we are going to end soon. Let's take the last question from here. Yeah. Okay, Cha, thank you for the question. My 2 weeks baby always refuses to latch at times. Sometimes halfway through as well. Any reason? Okay. It's quite a number of reasons. Alright, maybe baby is gassy, so that's why they don't feel comfortable in little bug. Maybe because of milk food supply, too fast or too slow. Alright, so because of this condition, actually a lot of things that we need to screen. So that's why I will advise you if to consider book a lactation consultation visit. So when you come in, we will look at your baby behavior and let you know step by step what is happening, how to manage it. I hope I have answered all your questions. Yeah. Thank you all for joining us today, and I've enjoyed the session so much. So if we didn't get to your questions, or you have more questions to ask, please call or email Alvernia Parentcraft Center. Please look out for next live session. The details will be on our social media. So follow us on our social Facebook, Instagram, TikTok to stay informed. And see you again. Thank you very much for your question, your anticipation, and your and your attendance here. Yeah. Okay. Thank you.